So the sort of the scientific community was surprised when the FDA released this warning about the risk of T-cell lymphoma after CAR T-cell. And the reason is because in our experience, we didn't observe an increased risk of T-cell lymphoma in our patient, but we took very seriously the warning from the FDA. And besides, of course, discussing with colleagues and put together commentaries, etc., we also actually look at our patients. So we recently published a study in Nature Medicine where we look at all our commercially treated CAR T-cell, and these include CAR-19, CAR-BCMA. We studied about 450 patients, and the goal was to understand if there were, what was the rate and incidence of secondary primary malignancies, including T-cell lymphoma. And what we found is that with a follow-up of about, median follow-up of about 10 months, we had about 3.6% of secondary malignancies. And if you look at what type of cancer we were seeing both solid cancer and hematological cancer, in one single case of T-cell lymphoma. So overall, the incidence of secondary primary malignancies was about 15%, which is sort of not really different than what you would expect in the same patient population that is treated with chemotherapy or radiation therapy. So it is actually lower than what you see in patients receiving transplant. So I think overall, if you look at the secondary primary malignancy incidence after CAR T-cell is pretty similar to what we see in the same patient, again, with chemotherapy. But obviously there was sort of interest to look into the case of the T-cell lymphoma because one report from ASH, the American Society of Hematology, showed that there was a case where a T-cell lymphoma did encode the CAR in the lymphoma cells. And so that clearly speaks to the fact that it's correlated to the CAR. So in our case, in our patient, we did not see CAR expression in the tumor. This was a patient with a gray zone lymphoma who developed a T-cell lymphoma 3 months after infusion of CD28 CAR-19 axi-cel. And we analyzed the T-cell lymphoma was clonal, we had a CD8 phenotype, but again, as I mentioned, was not CAR positive. Something interesting about this case is that it was diagnosed within a surgery for lung cancer. So basically the patient underwent lung cancer surgery, and one of the lymph nodes was the T-cell lymphoma. And the patient actually unfortunately died for the lung cancer, but the T-cell lymphoma was in remission. So this is sort of just to say that in our experience, the secondary malignancies after CAR are sort of in range with what we expect. And we didn't have any case of CAR positive T-cell lymphoma. I'm aware of 2 or 3 cases of CAR positive T-cell lymphomas around the world. So clearly that would be an issue that would be clearly related to CAR, but we didn't have them. And even with these 2 or 3 cases, overall the incidence is extremely low. So the benefit of CAR T-cell would certainly overcome, will sort of outweigh the risk of secondary malignancy.